Hey friends! Welcome to the Adult Nurse CBT quiz. Sharpen your skills and get ready to ace the test. Subscribe and ring the bell to stay updated with our latest videos and resources. Let's dive in. A patient with COPD is experiencing dyspnea and increased respiratory rate. Which position would best help to improve their breathing? It's A, high Fowler's. High Fowler's position, sitting up at 90 degrees, helps expand the lungs, allowing for easier breathing in patients with COPD. The other positions can exacerbate breathing difficulties. A 50-year-old patient is post-op from abdominal surgery. Which sign is an early indication of hypovolemic shock? It's B, tachycardia. Tachycardia, increased heart rate, is often the body's first compensatory response to hypovolemia. Hypotension and cold, clammy skin are later signs. A patient presents with severe diarrhea for the past 3 days. Which electrolyte imbalance is the patient most at risk for? It's C, hypokalemia. Diarrhea can lead to a significant loss of potassium, resulting in hypokalemia, which can cause muscle weakness and cardiac issues. Which of the following actions is most appropriate to prevent pressure ulcers in bedridden patients? It's A, repositioning every 2 hours. Regular repositioning relieves pressure and prevents pressure ulcers. Massaging reddened areas can damage underlying tissues. What is the primary purpose of a urinary catheter in a patient with acute urinary retention? It's D, to relieve urinary retention. In cases of acute urinary retention, the primary purpose of catheterization is to empty the bladder and relieve discomfort. A diabetic patient is experiencing hypoglycemia. Which symptom would you expect to see? It's A, diaphoresis. Diaphoresis, excessive sweating, is a common symptom of hypoglycemia due to the body's release of adrenaline in response to low blood sugar. When preparing to administer medication via a nasogastric NG tube, which action is essential? It's A, aspirating stomach contents. Aspiration confirms tube placement and prevents misplacement into the lungs. The patient should be upright, and medications are flushed with warm water. Which of the following vaccines is recommended annually for adults, especially those with chronic health conditions? It's A, influenza. The influenza vaccine is recommended annually to protect against the flu, especially in vulnerable populations like those with chronic conditions. A patient reports a history of allergy to penicillin. Which of the following antibiotics should be used with caution? It's C, amoxicillin. Amoxicillin is a penicillin-type antibiotic and should be avoided in patients with penicillin allergies due to the risk of an allergic reaction. A nurse observes that a patient has developed jaundice. Which organ is most likely affected? It's D, liver. Jaundice, a yellowing of the skin and eyes, is often due to liver dysfunction, affecting bilirubin processing. Which nursing intervention is most effective in reducing the risk of a patient developing pneumonia post-surgery? It's B, encouraging early ambulation. Ambulation helps mobilize respiratory secretions and prevents lung complications like pneumonia. A patient has been prescribed a beta blocker for hypertension. Which adverse effect should the nurse monitor for? It's B, hypotension. Beta blockers can lower blood pressure, so hypotension is a potential side effect. A patient with heart failure is prescribed furosemide. What is the primary purpose of this medication? It's A, to reduce fluid overload. Furosemide is a diuretic used to reduce fluid buildup in heart failure patients. Which laboratory test is commonly used to assess kidney function? It's D, blood urea nitrogen, BUN. BUN levels indicate kidney function. Elevated levels suggest impaired renal function. A patient with a history of deep vein thrombosis, DVT, is at risk of developing which complication? It's A, pulmonary embolism. DVT can lead to a pulmonary embolism if a blood clot travels to the lungs. A patient is in severe pain and rates it as a 9 out of 10. Which medication would be most appropriate for immediate pain relief? It's A, morphine. Morphine, a strong opioid analgesic, is suitable for severe pain and offers rapid relief compared to NSAIDs. Which finding is most consistent with chronic venous insufficiency? It's A, brownish skin discoloration. Chronic venous insufficiency often leads to venous stasis and hemosiderin staining, causing a brownish discoloration on the lower legs. The primary purpose of incentive spirometry in post-op patients is to It's C, prevent atelectasis. Incentive spirometry helps keep the alveoli open, reducing the risk of atelectasis and pneumonia. A patient is experiencing chest pain. Which intervention should the nurse prioritize? It's D, obtain an ECG. An ECG is essential to evaluate for myocardial infarction or other cardiac causes of chest pain. A diabetic patient is on insulin therapy. Which dietary advice is most appropriate? It's B, consume consistent carbohydrate amounts per meal. A consistent carbohydrate intake helps maintain stable blood glucose levels, which is essential for insulin-dependent diabetics. A nurse is caring for a patient with dehydration. Which IV fluid would likely be prescribed to quickly expand the vascular compartment? It's A, 0.9% normal saline. 0.9%. Normal saline is isotonic and effectively expands the vascular volume, which is ideal in cases of dehydration. Hypotonic solutions like 0.45% saline do not rapidly expand intravascular volume. A nurse administers heparin to a patient. Which lab test should be monitored to assess for therapeutic effects? It's D, activated partial thromboplastin time, APT. APT is the primary lab used to monitor heparin therapy as it reflects clotting time affected by heparin. A patient with a nasogastric tube has a pH reading of 7 in aspirated gastric contents. What should the nurse do next? It's A. Verify tube placement with an X-ray. A pH of 7 is not typical for stomach contents, which should be 1-5, indicating the tube may be misplaced. X-ray confirmation is the most accurate way to check placement. In a patient with hypocalcemia, which symptom should the nurse monitor? It's A. Tetany. Tetany, characterized by muscle spasms and cramps, is a hallmark sign of hypocalcemia due to increased neuromuscular excitability. A patient with severe burns requires fluid resuscitation. Which formula is commonly used to calculate fluid requirements? It's A. Parkland formula. The Parkland formula calculates fluid needs in burn patients, using body weight and percentage of burn surface area to guide resuscitation. Which vital sign change is most indicative of early septic shock? It's C. Tachypnea. Increased respiratory rate, tachypnea, is an early sign of sepsis, as the body attempts to compensate for low oxygen levels and metabolic acidosis. A patient receiving warfarin therapy presents with an INR of 4.5. What should the nurse anticipate? It's D. Administering vitamin K. An INR above the therapeutic range, usually 2-3, indicates increased bleeding risk, and vitamin K can help lower the INR. For a patient on opioid pain medications, which common side effects should the nurse monitor? It's B. Constipation. Opioids frequently cause constipation by slowing gastrointestinal motility. Preventative measures include increased fluids, fiber, and possibly stool softeners. Which lab value would a nurse expect to be elevated in a patient with an acute infection? It's D. White blood cell count, WBC. WBC count typically rises as part of the body's immune response to infection. In patients with chronic kidney disease, which dietary restriction is usually recommended? It's B. Low protein intake. Protein restriction helps reduce kidney workload by minimizing waste production, which is beneficial for those with kidney disease. Which symptom is commonly associated with hypoglycemia? It's B. Shakiness. Hypoglycemia often causes shakiness, sweating, and anxiety due to the body's response to low glucose levels. Which sign indicates effective chest compressions during CPR? It's A. Carotid pulse with each compression. A palpable carotid pulse with each compression confirms effective blood circulation during CPR. A nurse is caring for a patient with a colostomy. What color should the stoma normally be? It's D. Bright red. A healthy stoma appears bright red, moist, and similar in appearance to mucous membranes, indicating good blood flow. For a patient with respiratory acidosis, which condition is most likely the cause? It's A. Hypoventilation. Hypoventilation leads to CO2 retention, resulting in respiratory acidosis as CO2 forms carbonic acid in the blood. What type of isolation is recommended for a patient with tuberculosis? It's A. Airborne. TB is transmitted via airborne particles, so airborne precautions and an N95 respirator are necessary. A patient with cirrhosis has asterixis. What does this indicate? It's A. Liver failure. Asterixis, or flapping tremor, is often seen in liver failure due to hepatic encephalopathy, indicating high ammonia levels affecting the brain. Which of the following is a priority for a nurse caring for a patient with dysphagia? It's C. Sitting the patient upright. Upright positioning reduces the risk of aspiration in patients with difficulty swallowing, dysphagia. A patient with a tracheostomy tube needs suctioning. Which is the correct suction pressure for adults? It's D, 80 to 120 mmHg. The recommended suction pressure for adults is 80 to 120 mmHg, as higher pressures can cause trauma to the tracheal mucosa. A patient's potassium level is 6.5 mg/L. Which medication may be prescribed to lower potassium? It's B. Kayexalate. Kayexalate, sodium polystyrene sulfonate, exchanges sodium for potassium in the intestines, lowering serum potassium levels. A nurse observes redness and swelling around an IV site. Which complication should the nurse suspect? It's A. Phlebitis. Redness, swelling, and tenderness around an IV site are typical signs of phlebitis, an inflammation of the vein. A nurse is preparing to administer digoxin to a patient. Before giving the medication, the nurse should check which vital sign? It's D. Apical pulse. Digoxin can lower the heart rate. Therefore, the apical pulse should be checked before administration. If it's below 60 BPM, the medication is typically held. A patient is diagnosed with C. difficile infection. Which of the following isolation precautions is appropriate? It's A. Contact precautions. Difficile is transmitted through direct contact, requiring contact precautions including gloves and gown to prevent spread. Which type of insulin has the shortest onset of action? It's A. Insulin Lispro. Insulin Lispro is a rapid-acting insulin with an onset of 15-30 minutes, which is faster than regular or NPH insulin. In assessing for signs of fluid overload in a patient receiving IV fluids, which symptom would the nurse most likely find? It's A. Jugular vein distension. Jugular vein distension is a classic sign of fluid overload, indicating elevated central venous pressure. A patient is prescribed an ACE inhibitor for hypertension. Which side effect should the nurse monitor? It's C. Persistent cough. ACE inhibitors can cause a persistent dry cough due to increased levels of bradykinin. If this occurs, an alternative medication may be considered. When providing patient education about a low-sodium diet, which food should the nurse recommend avoiding? It's D, canned soup. Canned soup is typically high in sodium and should be avoided in low-sodium diets. Which type of medication is commonly prescribed to treat heart failure by increasing urine output? It's B, diuretic. Diuretics, like furosemide, help reduce fluid overload and relieve symptoms in heart failure by increasing urine output. A nurse is preparing to draw blood from a central venous catheter. What is the first step? It's A, withdraw and discard a small amount of blood. Discarding the first few ml of blood removes potential contaminants and ensures an accurate sample. A patient with suspected tuberculosis should be placed in a room with what type of ventilation? It's B, negative pressure ventilation. Negative pressure prevents contaminated air from escaping the room, helping to prevent airborne spread of TB. A patient with atrial fibrillation is prescribed warfarin. Which blood test will the nurse monitor to assess therapeutic effectiveness? It's C, International Normalized Ratio, INR. INR is used to monitor warfarin therapy. A therapeutic range usually falls between 2 and 3 for patients with atrial fibrillation. Which nursing intervention is most important for a patient with new onset of left-sided weakness and slurred speech? It's A, perform a neurological assessment. Left-sided weakness and slurred speech are potential stroke symptoms, requiring an immediate neurological assessment. Which of the following medications is a common treatment for an acute asthma attack? It's D, salbutamol. Salbutamol is a bronchodilator used to quickly relieve bronchoconstriction in an acute asthma attack. When caring for a patient with hypothyroidism, the nurse would expect which clinical finding? It's A, cold intolerance. Cold intolerance is a common symptom of hypothyroidism, as the reduced metabolism decreases heat production. A patient presents with pinpoint pupils, respiratory depression, and unconsciousness. The nurse suspects an overdose of It's A, opioids. Opioid overdose often leads to pinpoint pupils, respiratory depression, and unconsciousness. Naloxone may be required as an antidote. A nurse is teaching a diabetic patient about foot care. Which instruction should be included? It's A, inspect feet daily for injuries. Daily inspection helps detect early signs of injury or infection, reducing the risk of complications in diabetic patients. In a patient receiving chemotherapy, which blood test result would indicate bone marrow suppression? It's C, decreased platelet count. Bone marrow suppression often leads to decreased platelet counts, increasing the risk of bleeding. When educating a patient on signs of a blood transfusion reaction, the nurse should include which symptom? It's D, chest pain. Chest pain is a possible sign of a hemolytic transfusion reaction, along with fever, chills, and hypotension. A nurse is reviewing a medication order for a patient with renal impairment. Which medication should be used with caution? It's B, ibuprofen. NSAIDs like ibuprofen can reduce renal blood flow and worsen renal impairment, so they should be used cautiously. A patient taking lithium is admitted with nausea, vomiting, and diarrhea. Which condition should the nurse suspect? It's B, lithium toxicity. Nausea, vomiting, and diarrhea are signs of lithium toxicity, especially if blood levels are not monitored regularly. For a patient at risk of hypovolemic shock, which intervention is most appropriate? It's A, position the patient supine with legs elevated. This position helps improve blood flow to vital organs by encouraging venous return to the heart, an important measure in hypovolemic shock. A nurse needs to administer 500 ml of IV fluid over 4 hours. The IV administration set has a drip factor of 20 drops per ml. How many drops per minute should the nurse administer? It's D, 25 drops min. Calculation: 500 ml x 20 drops ml, 4x 60, = 25 drops a min. A patient is prescribed 200 milligrams of a medication. The available concentration is 50 mg/ml. How many ml should the nurse administer? It's A, 4 ml. Calculation: 200 milligrams, 50 mg/ml = 4 ml. A patient on heparin therapy has an AAPTT of 90 seconds. The therapeutic range is 60-80 seconds. What should the nurse do? It's A, decrease the heparin dose. And a PTT of 90 seconds is above the therapeutic range, indicating an increased risk of bleeding. The dose should be decreased. A nurse is caring for a patient with a serum potassium level of 2.8 mql. Which of the following findings should the nurse anticipate? It's A, muscle weakness. Hypokalemia often leads to muscle weakness and fatigue due to the role of potassium in muscle contraction. A patient has an order for 1,000 ml of 0.9% NaCl to be infused over 8 hours. The IV set delivers 15 drops per ml. How many drops per minute should the nurse administer? It's C, 31 drops min. Calculation: 1,000 ml x 15 drops ml, 8x 60, = 31 drops min. A nurse is reviewing lab results of a patient with chronic kidney disease. Which lab finding is expected? It's D, elevated potassium. Patients with chronic kidney disease often have elevated potassium levels due to decreased excretion by the kidneys. A medication order requires administering 0.25 milligrams of digoxin. The available concentration is 0.125 milligrams per tablet. How many tablets should the nurse give? It's B, 2 tablets. Calculation: 0.25 milligrams, 0.125 mg tablet, = 2 tablets. Which electrolyte imbalance is most associated with prolonged use of diuretics? It's A, hypokalemia. Diuretics often cause potassium loss, leading to hypokalemia, unless they are potassium-sparing diuretics. A patient is prescribed morphine 4 milligrams IV every 4 hours. The available concentration is 10 mg/ml. How many ml should the nurse administer? It's D, 0.4 ml. Calculation: 4 milligrams, 10 mg/ml = 0.4 ml. When providing care for a patient with COPD, which oxygen delivery device is most appropriate for maintaining low, precise oxygen levels? It's A. Venturi mask. A Venturi mask allows precise control of oxygen concentration, which is crucial for COPD patients to prevent respiratory suppression. A nurse is preparing to administer 1 gram of vancomycin, diluted in 250 ml of normal saline over 90 minutes. What is the infusion rate in ml per hour? It's A. 167 ml hour. Calculation: 250 ml, 1.5 hours, 90 minutes. Equal sign, 167 ml hour. A patient with hyperthyroidism is likely to present with which of the following symptoms? It's A. Weight loss. Hyperthyroidism increases metabolic rate, often leading to weight loss, heat intolerance, and other symptoms of heightened metabolism. Which of the following interventions should the nurse implement for a patient at risk of aspiration? It's C. Position the patient in an upright sitting position. Upright positioning reduces the risk of aspiration, especially in patients with swallowing difficulties. A patient is admitted with diabetic ketoacidosis, DKA. Which lab value is expected? It's D. High potassium level. DKA often leads to hyperkalemia as potassium shifts out of cells due to acidosis, although insulin therapy later decreases potassium levels. Which nursing intervention is most important for a patient experiencing chest pain? It's B. Apply oxygen. Oxygen is crucial during chest pain to improve oxygen delivery to the heart and prevent myocardial damage. A patient's order is 300 milligrams of ampicillin IV. The medication is available in a 500 milligrams vial, which must be reconstituted with 2 ml of sterile water to yield a concentration of 250 mg/ml. How many ml should the nurse administer? It's D. 1.2 ml. Calculation: 300 milligrams, 250 mg/ml equal, sign 1.2 ml. Which sign is often the earliest indicator of hypoxia in a patient? It's B. Restlessness. Restlessness or agitation is often an early sign of hypoxia, as the brain is sensitive to oxygen deprivation. A nurse is monitoring a patient receiving digoxin. Which symptom indicates potential digoxin toxicity? It's B. Visual disturbances. Digoxin toxicity often includes visual disturbances such as seeing halos, nausea, and arrhythmias. A patient with pneumonia has thick, tenacious sputum. Which intervention is most appropriate to help thin secretions? It's A. Increase fluid intake. Adequate hydration helps to thin secretions, making them easier to expectorate in patients with respiratory infections. A patient has been prescribed nitroglycerin for angina. What important instruction should the nurse provide? It's D. Lie down when taking the medication. Nitroglycerin can cause hypotension and dizziness. Lying down helps prevent falls and manage symptoms. A nurse is to administer 1.5 g of an antibiotic IV. The available solution is 500 mg 2 ml. How many ml should the nurse administer? It's A. 6 ml. Calculation: 1,500 milligrams. 500 milligrams x 2 ml equals sign 6 ml. Which nursing intervention is most important for a patient with dysphagia? It's A. Position the patient upright during meals. An upright position reduces the risk of aspiration, especially in patients with swallowing difficulties. A patient with diabetes mellitus is ordered 10 units of regular insulin and 15 units of NPH insulin. What is the total number of units to be administered? It's A, 25 units. Adding both insulin doses, 10 plus 15 equals 25 units total. A nurse is assessing a patient with chronic obstructive pulmonary disease, COPD. Which finding is expected? It's C, barrel-shaped chest. COPD can cause lung hyperinflation, leading to a barrel-shaped chest. A patient is ordered 1,000 ml of IV fluid over 12 hours. The IV set has a drip factor of 10 drops per ml. How many drops per minute should the nurse administer? It's D, 14 drops min. Calculation, 1,000 ml x 10 drops ml, 12 x 60, =, 14 drops min. Which electrolyte imbalance is commonly seen in patients with severe burns? It's B, hyponatremia. Severe burns can lead to significant sodium loss through fluid shifts, causing hyponatremia. A nurse needs to administer 0.5 milligrams of atropine IV. The vial is labeled 1 mg/ml. How many mml should be given? It's A, 0.5 ml. Calculation, 0.5 milligrams, 1 mg/ml =, 0.5 ml. A patient is receiving 3,000 ml of IV fluids in 24 hours. How many ml per hour should the infusion pump be set to deliver? It's D, 125 ml hour. Calculation, 3,000 ml. 24 hours =, 125 ml hour. Which of the following assessment findings is most concerning for a patient receiving morphine? It's A, respiratory rate of 8 breaths per minute. A respiratory rate of 8 is dangerously low and may indicate opioid-induced respiratory depression. A nurse needs to administer 300 milligrams of a drug IV. The available solution is 100 mg 2 ml. How many ml should be given? It's A, 6 ml. Calculation, 300 milligrams, 100 milligrams, x 2 ml =, 6 ml. A patient with hypothyroidism is most likely to experience It's A, cold intolerance. Hypothyroidism reduces metabolic rate, leading to symptoms like cold intolerance, weight gain, and fatigue. A patient's blood glucose level is 9 mmol/L. What is the approximate equivalent in mg/dL? It's C, 162 mg/dL. To convert mol/L to mg/dL, multiply by 18. 9 mol/L x 18 =, 162 mg/dL. A nurse is administering a liquid medication and notices the prescribed dose is in ml, but the concentration is provided in mg. What should the nurse do first? It's D, hold the dose until clarification. Medication doses must be clearly understood in mg and ml to ensure safe administration, so clarification is essential. A patient is receiving an IV antibiotic that must be infused over 45 minutes. The volume to infuse is 100 ml. What is the infusion rate in ml per hour? It's B, 133 ml hour. Calculation, 100 ml 45 minutes, x 60 minutes =, 133 ml hour. A nurse is providing education on dietary sources of calcium. Which food should the nurse recommend? It's A. Cheese. Dairy products like cheese are excellent sources of calcium, which is important for bone health. Which of the following interventions is most appropriate for a patient experiencing hypoglycemia? It's C. Administer a source of fast-acting glucose. Fast-acting glucose, like juice, will quickly raise blood sugar levels, relieving hypoglycemia symptoms. A patient requires a dopamine infusion at a rate of 5 mg/kg/min. The patient weighs 60 kilograms. The dopamine concentration is 400 milligrams in 250 ml. What is the required ml per hour rate? It's D, 22.5 ml/hour. Calculation: 5 mcg x 60 kilograms, 1000. Equal sign 0.3 milligrams per minute. 0.3 milligrams per minute x 60 minutes equal sign 18 mg/hour. 18 mg/hour, 400 milligrams, x 250 ml equal sign 22.5 ml/hour. A nurse is evaluating a patient who complains of frequent nosebleeds. Which condition should be considered as a possible cause? It's B, hypertension. High blood pressure can cause the small vessels in the nose to rupture, leading to frequent nosebleeds. A nurse prepares to administer a 250 milligrams dose of medication available as a 500 mg/5 ml solution. How many ml should the nurse give? It's D, 2.5 ml. Calculation: 250 milligrams, 500 milligrams, x 5 ml equal sign 2.5 ml. A nurse is observing a patient post-surgery for signs of atelectasis. Which of the following is an early indicator? It's C, decreased breath sounds. Atelectasis can cause decreased or absent breath sounds in the affected lung area due to collapsed alveoli. Great job completing the medical quiz. Keep up the learning, and remember, each step brings you closer to mastering your skills. Thanks for joining, and see you next time.